afternoon, everybody. We're getting back to our program. I hope everybody's enjoying lunch. I have this. Oh. Thank you. That's my people over there, I'm sure. I have the privilege of introducing our first speaker, Dr. Monica Burrell, Commissioner of the Massachusetts Department of Public Health. Dr. Burrell is a leader and champion for improving the lives of those experiencing homelessness, and is a true friend to us at Public Health and here in the city of Boston. Dr. Burrell became commissioner in February of 2015. As commissioner, she's responsible for just a few things, including implementing the state's response to the opioid crisis, finding public health solutions for healthcare reform, developing innovative solutions using data and evidence-based practices, and other health quality improvements. Dr. Burrell comes to DPH widely recognized for her dedication to health care for underserved and vulnerable populations. She previously served as the Chief Medical Officer of Boston's Healthcare for the Homeless program, the largest nonprofit healthcare organization for homeless individuals in the country. Please help me by welcoming Dr. Burrell up.
Hello, everyone. Good afternoon. Hope you're enjoying this lovely afternoon and your salad. It's wonderful to be here with you today, which I understand is the first annual luncheon. So thank you for supporting this really important cause, and I'm thrilled to be here with you and the mayor today. Whenever I have a chance to speak at an event like this, it really gives me the opportunity to think about my patients. You heard a little bit about my background, but I had the great honor of working at Boston Healthcare for the Homeless program for 12 years and at the former Boston City Hospital before that, and have really learned so much from the experiences of my patients. So while you're enjoying your lunch, I just want to take you on a journey with me so you can understand a little bit my point of view and what I brought to the department about how we think about some of these issues that you've gathered to support here today. One of the patients that I think about often, I'll call Michael. Every Wednesday morning when I was at Healthcare for the Homeless, I had an open access clinic. So that's an open clinic where anybody can walk in, and it was never boring, and no two Wednesdays were ever the same. One Wednesday, one of our nurses called me in to see a patient. I walked in to meet Michael. He smiled distrustfully, made a couple of jokes to break the tension, and then the nurse and I looked at his bottles of medicine that he had in his backpack. He had 20 different bottles of medicines with him, some open, some not, some that would interact with others, some he understood how to use, some he didn't. And the medications really told the story of a complicated medical history. There were blood thinners and medicines for ulcers and medicines for his heart. And over the next year, I got to know Michael. And he slowly started to talk to me about his great distrust in the government, in medical care, in the VA system. He revealed reluctantly that he had served in the armed forces, had a job where he should be receiving a pension, and much more. Although he didn't talk much about the deep despair that led him to where he was now, we tried really hard to help him with his medical issues. You see, he was sleeping in a couple of cardboard boxes in downtown Boston, and he was in his 70s and fragile, and we were worried about him. One of the great things about Healthcare for the Homeless was that there we would treat much more beyond the medical condition. He was connected to case management and to other support services where he would accept them, and he was given housing in Dorchester. Maybe to the surprise to everyone except him, he went from his housing often, really most nights, back to the boxes in downtown Boston. I would see him every time he came back to clinic to drop in and see me. I would sigh with relief that he was back, he was safe, He'd give me his wary smile and tell a few of his jokes, sometimes inappropriate ones. And then one day, like too many people in his situation, he stopped coming to clinic. And when I heard that he had passed away, I sat for a moment and I cried. I added his memory to the many other patients that I now missed and used the gift of their connection and presence to strengthen my fortitude for this work. People like Michael need so much. They need help to navigate our healthcare system and our social service system. It's so complicated. They need help going from our emergency shelter system through our healthcare system to housing and beyond. And that takes patience, fortitude, and compassion for decisions people make that sometimes you and I don't understand why. And in my current role as commissioner at the Massachusetts Department of Public Health, I see a fundamental role for our department in promoting health and promoting health equity and fairness. My understanding of this fairness and equity in health started long before I understood the medical sciences. As the proud daughter of hardworking immigrants, I was fortunate enough to travel outside of the US to visit family and friends. And it's there that I came face to face for the first time with poverty, and it really helped shape my own career aspirations and goals. But I associated that poverty with something far away from my home, far away from what I called home in New York and the abundance of our great country. When I came to Boston in the late 1980s to go to Boston University, that all changed. I was fortunate enough as a student to meet a nurse, Anna Bissonette. She was establishing a novel program to build housing for homeless elders. To me, the thought of 70, 80, 90-year-old individuals here in Boston living in the shelter system and on the streets was implausible. So I jumped in and began filling in small ways that college students can, filling out surveys, painting the house, and engaging with the individuals who would then become residents of this first home on Bishop Street. In essence, I was beginning to develop a fundamental understanding of the social determinants of health before I even knew what those terms meant. And as I heard about the struggles of these individuals who were enduring and trying to keep themselves healthy, I was angry about the unfairness. As I gained medical knowledge in medical school, having the foundational understanding of these social determinants of health really helped me to better approach the care of my patients' medical needs in their social context. Just like all of us, we want our medical and health needs taken care of in the context of our social situations. As I learned how to take care of congestive heart failure and which medicines to prescribe for diabetes, that part started to come easier. But my patients asked me the hard questions. How should they get access to healthy food that they can afford, that they can't afford, but they know they need to eat for their heart disease or diabetes? And where should they store their insulin that needs to be refrigerated when they're sleeping under the bridge? Having spent many days and sleepless nights working in hospitals across Boston and Massachusetts, and now with a bird's eye view from the Department of Public Health, I'm a strong believer that this state represents the greatest place in the world to receive medical care. We are truly blessed with the most impressive collection of compassionate, intelligent, and dedicated nurses, doctors, and public health experts. And you may have heard now, Massachusetts is ranked the healthiest state in the country. And that is something we should all be proud of, and that's because of our dedicated high-quality medical care and decades worth of smart health programming and health policy. But we're here today because we want to make sure that in that #1 status and the best healthcare in the world, we don't lose sight that there are some of us in this great place who are not able to attain that #1 status, that there are often invisible pockets of people who in a very real way live in a different Massachusetts, literally in the shadows of our great civic and medical institutions. We know that from birth to death, the circumstances of an individual's life drastically impact their health. Infant mortality rates still are increased along socioeconomic and racial lines. And mortality rates are linked to zip code more than any other factor. Let me make sure that's clear. In 2018, in Massachusetts, place still matters more than any other factor. Place still matters more than any other factor in how well any of us will live or how long. And this, to me, is the biggest public health risk facing our society today. It's the biggest public health risk, these endemic health inequities. And our mission at the Department of Public Health is really embedded in alleviating these health inequities. It's to promote wellness and health equity for all individuals across the Commonwealth. And as I think about Michael and so many other patients, I know that to truly serve all of our residents, we need to be creative, innovative, and stretch ourselves beyond what we think is possible. My primary priority as commissioner is to bring a real focus to identifying, triaging, and treating health inequities, which remain the real barrier to achieving true, equitable, and accessible health for all of us. Massachusetts, if any place does, Massachusetts has the capacity to be a leader in outcomes-focused public health and health that's based on a data-driven approach and focused on resolving these inequities. And to give you some example of the work we're doing at the department, we're working to improve our data collection and reporting to better identify and document populations who are experiencing these disparities and promote promising solutions to these issues. As an example, this includes, for the first time ever at the Department of Public Health, we've developed a way to understand whether someone has had an episode of homelessness or housing instability and link that directly to their health outcomes. In our work in the current opioid epidemic, we've used this to highlight the extraordinary risk of death associated with someone who has opioid use disorder and homelessness. They have a 30 times higher risk of dying, 30 times higher, which allows us then, as we think about our programming, to make sure that part of recovery is about ensuring people have stable housing opportunities that takes them out of this cycle of relapse, opioid use, and homelessness. Another example is that for the first time, we have set 4 health priorities, state health priorities, to assist our colleagues in the healthcare system in how they distribute their community health initiative funding. We came up with these 4 health priorities looking to see in Massachusetts, what do individuals become prematurely ill from and die prematurely from? And those 4 health priorities are, #1, the prevention of preventable chronic disease like diabetes and heart disease, mental health and mental wellness, substance use disorder, and again, for the first time ever, homelessness and housing instability. So our healthcare partners are also focused on moving upstream, if you will, from just treating the disease to understanding the health impacts of homelessness and beginning to work together to alleviate that with housing stability. There's one more patient I want to tell you about before I close. He's someone who's very dear to me because he's one of the last people I saw before I left in 2015 to come here to the state. I'll call him Keith. I had known Keith for about 10 years. He was a very sweet man with very severe schizophrenia. He believed that he couldn't take his antipsychotic medicine, the medicine that would alleviate his schizophrenia, because if he took the pill, he would have a government agent implanted in his brain. He believed that, and it was very hard to get over that. He also had high blood pressure and diabetes that was causing lots of medical complications. Over 10 years, I saw him. I tried to convince him to take his medications for his heart disease and his diabetes, and he wasn't able to. I also engaged him with a psychiatrist. We worked as a team. And he began to trust us. He began to trust other team members, but I lost track of him. He slept in one of the local shelters. On my second to last day at Healthcare for the Homeless, before coming to the state, I saw him in the streets, and he stopped me and he said, "Hello, Dr. Monica. Would you like an apple?" And I said, "No, I want you to have it. How are you doing?" And he said, "I've started to take medications." He had started to take the medicine for his schizophrenia, and then was able to accept the medications for his high blood pressure and his diabetes. And with tears in his eyes, he said, "For the first time in 15 years, I've re-engaged with my family in Chicago. They've wondered where I've been for 15 years. And I'm housed, and I feel good." And just like any one of us, he describes health like we all would, being connected to our families and our loved ones, having a home, and feeling well. And by being here today, you are supporting that work and the ability with patience and dedication for so many to achieve this capacity, for us to move beyond place being the most important factor and to move towards health equity. So I thank you all for being here, and I really thank you for giving me the opportunity to speak with you today. Thank you.
Hey, Monica, thank you. Hi, could I have everyone's attention just for a minute? So as I mentioned earlier, my name's John Rosenthal. I'm the founder of the Friends of Boston's Homeless. We founded and created the Friends of Boston's Homeless in 1987, a little over half my life ago, and I'm so proud to say that we've created a vehicle for people in the business community to plug into the solution of homelessness. We created this because in 1987, roughly 25 to 30% of people living in shelters went to work every day. Minimum wage is $800, and average rent in the city of Boston is closer to $1,800. This is an affordable housing crisis. And in 1980, the HUD budget was $34 billion, and there were roughly 200,000 homeless people in this country. By '88, when Reagan left office, the HUD budget was $9 billion, and the number of homeless people was over 2 million. So this is really, homelessness has largely been as a result of bad public policy leading to bad public health outcomes, and the lack of affordable housing, and the lack of prioritizing the people who are most in need. And I think that frankly, the more you have, the more you have to give, or you get crazy like everyone we know with too much. And the true measure of a civilized society is how we treat those less fortunate. And the more you give, the more you get. And if you live to be 90, that's 780,000 hours. That's all you get. And what you do with those hours, and who you connect with, and whose lives you help make better, is all you have. And there's a role for the private sector to play in helping government develop good public policy and good public health outcomes. And I can't really describe, like many of you, why we got so lucky. But the Friends is all about doing something with your good fortune. And the more you give, the more you get. And that just starts to log roll. So here in the city of Boston, we are beyond lucky to have a mayor who's really just a guy who grew up in Boston, who's overcome more hardship than most of us will ever know as a result of childhood cancer, as a result of being shot, as a result of being in recovery and stable. And this is a guy, I mean, who just has a heart and a soul that every mayor should have, but doesn't. And we are a partnership. So the Friends of Boston's Homeless partners with the City of Boston and the state to really hold each other accountable and develop programs to help move people beyond shelter and into independence. And our mayor, Marty Walsh, prioritizes this issue along with opioids and along with gun violence prevention. Unlike any mayor in America, and it is a huge honor for me to introduce my friend, our mayor, and one of the greatest friends of Friends of Boston's Homeless, Mayor Marty Walsh.
Thank you, John. And let me just clarify, for those of you in the room thinking like, all right, the mayor of Boston had cancer and was shot. What the hell's going on there? I was in the wrong place at the wrong time, and the cancer thing just comes. But I want to thank you, Commissioner Burrell. Your talk blew me away. I want to thank. We should thank you, Commissioner, for. When you hear stories like that, and the commissioner being a doctor and being out doing the work and hearing the stories, those are all true stories, and those are true people, and those stories are repeated time and time and time again. And every time that you walk by somebody on the street, and you look down at somebody in a box, or you look down at somebody sitting on the corner, everything the commissioner talked about is probably what's going on in their brain. They all have families somewhere else. At one point, they're still loved, a lot of people that are homeless, but they were loved. They had a roof over their head. They were able to come to an event like this, and something somewhere down the road took their life from them. And we're here today to be part of giving their life back. So, Commissioner, I want to thank you and everyone at the Mass Department of Public Health for the great work you've done. I want to thank Mary Ann and John and everyone, the Friends of Boston's Homeless, for the great work you do. I'll talk more about it in a minute. I want to give a shout out to my team, our team in City Hall. Jerry Thomas, the Director of Homeless Services for the Boston Public Health Commission. Jim Green. There's a table down that corner that do incredible work. I got a chance to read in a couple minutes some of the stats that we have in the city on what we've been able to accomplish in 4 years. And people say, oh, man, you've done a great job, you've done a great job, done a great job. That table down there has done a great job, so I want to thank them again for what they've done in the city of Boston. Incredible stuff. The word partnership is an important word that we need to use more of in government. That's not happening these days in many places, but having a partnership with organizations is extremely important. Nobody can make progress by themselves. The commissioner can talk about the great things that the state's doing, we can talk about the great things that we're doing, but if we're not working together, none of those great things are going to happen. If we don't have a partner like you in this room, Friends of Boston Homelessness, helping us, we can't do anything. Partnerships are key. The relationship between the City of Boston and the Friends is another level. It's an organization doing incredible work that needs to get done. You were doing it before anyone else was doing it. This organization took time to understand what people are experiencing with homelessness and what people really need, not just creating something to do, but actually finding out what the root cause of the problem is. You heard about that today. They turned their compassion into expertise. 31 years ago, this organization started. 31 years ago, this organization is still having a tremendous impact right here in the city of Boston and with our homeless services. I had to close Long Island Bridge in 2014. Some of you might know the story, some of you might not. Those that don't know, Long Island is out in Boston Harbor. It's an island that's owned by the city of Boston. On the island was homeless services, detox services, halfway houses, holdings, reentry programs, a whole bunch of different things. For years, we would gather up homeless people and take them on a bus and bring them out to the island at night and let them stay out there on the island in the morning. We'd pick them up and take them back off the island and let them go in Boston, and then at night we'd pick them back up, and that was a part of what we did in the city. Not that there was anything wrong with that, but that's where our homeless facility was. October 2014, I was in office literally 8 months, and my public works director came in and said, Long Island Bridge has to be shut down. And we knew it was in bad shape. And I said, when? He said, now. I said, you mean like right now? He goes, like right now. We're not letting cars on the bridge because the bridge is crumbling into the ocean. Now we have people on the island, homeless people, we have detox programs, we have recovery programs, we have reentry programs, we have staff, we have everything on the island, firehouse. And I said, okay, let's do it. I didn't have a minute to think about, well, what's the evacuation plan, because we couldn't use the bridge. And it took a lot of criticism for that, which is fine. And it should have been fixed in the city 10 years ago, but it wasn't. So we set up a temporary homeless facility in the South End, and we were housing homelessness. We were women's side, men's side, and trying to do it right, and trying to get it right, literally on a gym floor. We put paper down, and we put bunks in there and brought bunks over from the islands, and it was hard. And I started to think about what's going on at Long Island Bridge, what are we going to do here. Homeless activists were killing me on Twitter and Facebook and come at me, and you know, we were thinking about the situation. So what we did was we brought a couple of people from our homeless facility and said, okay, let's take an opportunity here, because this actually could be a good thing. We could actually do something completely different when it comes to homelessness. Rather than house somebody for a night and a day and a night and a day and feed them, let's think of a way, how do we do more than that? How do we create an opportunity to get people out of homelessness? And I went over to the shelter one day, and across the street we had a building, and the building was a transportation sign shop. And I walked into that sign shop, and I looked around and I said, this could be our new homeless facility. And people were like, well, you're crazy. And we brought together people around the table to build a brand new I'd say state-of-the-art facility for the men, and now we're fixing the women's side because it's horrible. But more importantly, we brought providers to the table. We brought organizations like the Friends and other people who do the work, and we sat at the table and said, what can we do here? And we came up with a system. We came up with a system to work on homelessness. We worked to make a new program called Boston's Way Home. How do we get people out of homelessness and into, like the commissioner was saying, and into long-term housing? And the first thing was in 2014 through 2015, Michelle Obama challenged cities around America to end chronic veterans homelessness by the end of 2015. And being from Boston and, you know, liking a challenge, we said, we'll do it. I had no idea how we're going to do it. I said, we're going to do it though. And I came back and we started talking. And by the end of 2015, we received a letter from HUD saying you had basically ended veterans homelessness in the city. And since 2014, we've housed 812 chronically homeless veterans in a home with wraparound services and programs and a new policy. Since 2015, we have housed 525 other additionally homeless people that were on the streets of Boston for a combined 3,000 years of homelessness living on the street. That's what we've been able to do working together. We've worked on creating 200 units of permanent supportive housing with the support of the Friends of the Boston Homeless. We've created on January 1st the Boston's Way Home Fund to produce more supportive housing, privately raised, working with Pine Street, To date, we've raised about over $3.5 million from private donations to be able to build 200 units of affordable housing. Other cities have seen, on average, an increase of 12% in their chronic homelessness on their streets. In Boston, we've reduced chronic homelessness between 2016 and 2018 by 20% on the streets of Boston. We just hosted the U.S. Conference of Mayors, and they were in Boston, and they're asking us for some solutions and what we can do. And we had events at the World Trade Center, we had events at different places, and some of the mayors were commenting on, we don't see homeless people on the streets of Boston. And then on Sunday night, we had an event at the public library, and I was grateful to see the homeless people living around the library. And the reason why I was grateful for that, so that mayors didn't think that we were hiding our problem. It was front and center. While we're inside having a party on the outside, there were people sleeping in the boxes that the commissioner talked about. They were sleeping on blankets. So it's a reminder for us that our work is not done. It's a reminder, even though I can talk about great stats and we're doing great things and homelessness is down, it might be down for today, but it's not down forever. There's still so much more work we can do. We still have thousands of people in Boston on our streets every day that we have to work with. They come from other places, they come from our own city. And it is important. It's important that we continue to support what you're doing here today. As mayor, this issue means an awful lot to me. It means a lot to me because I care about the people on the street, because I know that they're there not by their choice. A lot of them are there for a whole bunch of different reasons. How often, I was walking back from the public library the other night during the event, and there was 3 or 4 mayors with me, and there was a woman jumping on a sign that had fallen down, and I didn't know if she was homeless, and I couldn't tell at the time. And then we got up to her, and she looked at me, she goes, "Man, what are you doing?" She gave me a big hug. And, you know, we need to continue to fight for the people who need us to fight for them. I want to thank you in this room for your support of this incredible organization, because the state, the city, and everyone that's sleeping out there tonight needs your help. I want to thank John Rosenthal, who's been doing this for a long time. I actually met John. First time I met John, Matt O'Neill introduced me to John. I think it was the Friends of Boston Homeless event that I came because Maddie asked me to come to it. I was a state rep. Never in my wildest imagination realizing that I'd be standing at one of his events as mayor of the city of Boston one day talking about what we're doing. So John, thank you, and to your wife and your family that's here, thank you for your commitment and dedication, because all it does is take one person. To the team from the city, thank you for what you do. Jim Green, thank you. I was with Jim at an event not too long ago when the Fens, and we were talking about the homelessness situation, the Fens, and not just kicking people out. We don't kick people out anymore from corner to corner. We try to make investments and help them. So thank you for your investments. And to all of you in this room, whether you pay $10 or you pay $10,000, thank you for your support. Thank you for your love and support and your donations. It doesn't matter what you can give. Anything works because it all adds up. When we created Boston's Way Home Fund, we started with 0. We didn't have a penny. And I think the first donation was $50, and now we have $3.5, almost $4 million in the account towards 10. So every dollar counts. Thank you. Have a great day.